This lecture will cover the biological, psychological, and social factors that can influence health. We will then discuss the impact of stress on our health and how we can cope with it. Health psychology is a subdiscipline of psychology that incorporates the research on health and psychology. This field began when psychologists and physicians recognized the impact of behaviors and thinking on health outcomes and well-being. Well-being is the positive state that includes striving for optimal health and life satisfaction. To achieve this state, we need to engage in thinking and behaviors that enhance our health and avoid those behaviors that impact our health negatively. This is a vital area of study for health psychologists who examine the relationship between thoughts, actions, and health, both physical and mental. Additionally, they examine how health impacts our thoughts, actions, and emotions. In order to study these processes, many health psychologists use the biopsychosocial model of health. As you can tell from the name, this theory focuses on three categories of factors: biological, psychological, and social, and how they interact to affect health. Some examples of biological factors are genetic predispositions, exposures to germs, and changes during development. Psychological factors include personality, lifestyle, stress, beliefs about health, beliefs about norms of behavior, and thoughts. Social can include cultural influence, social support, relationships, and other features of the social environment. How does this work? Well, let's use for our example a young man who drinks too much at a party and passes out. What are the factors that might have influenced this behavior? What do you think might be some biological factors that led to this behavior? Perhaps this young man has a genetic predisposition towards alcoholism, or has a decreased ability to process alcohol. What about psychological factors? Well, it could be he was under a lot of stress at work or school. It could also be that he believed that excessive drinking was the expectation of that party. What about social factors? Well, it could have been due to peer pressure, with people actively encouraging him to overdrink. Or it could be that everyone else was drinking heavily, so he did as well. Likely it was a combination of factors rather than a single one which led to this behavior. The benefit of the biopsychosocial model is that it gives us multiple places to look for the source of behaviors, but it also gives us multiple ways to intervene to correct harmful behaviors or increase healthy ones. Intervention is important because the leading causes of death in this country can be decreased by reducing harmful and increasing healthful behaviors. The number one killer in the United States is heart disease, which is responsible for about a quarter of all deaths. Behaviors linked to heart disease are obesity, lack of exercise, smoking, high-fat diets, and some personality traits, which we will cover in detail later. While not all deaths from heart disease are preventable, changes in behaviors can greatly reduce our risks. Another category of deaths that can be reduced by changing behaviors are accidents, especially car accidents. This is especially true for teenagers and young adults, in which 48% of the deaths from this group are due to accidents, mostly auto accidents. What kind of preventable behaviors increase car accidents? When I was growing up, the big push was towards increasing the use of seat belts, though tragically people still die in accidents that they would have survived if they were wearing a seat belt. What other behaviors have been targeted by regulation agencies and prevention groups to decrease auto fatalities? Well, watching advertisements on television, we see that drunk driving is a major target. Also, talking on cell phones, or even worse, texting, are all very preventable behaviors that increase the dangers of driving. What other preventable causes of death can you think of? Well, suicide, unsafe sexual behaviors, drug use, firearms, all of these things can lead to an untimely death which could have been prevented. Even if these behaviors don't always kill, they could greatly reduce health and well-being. For example, unsafe sexual practices might not result in a fatal disease, but herpes or genital warts could have lifelong consequences for health and happiness. Thus, one major goal of health psychologists is to find ways to increase people's avoidance of harmful behaviors and increase their use of healthy ones. Have you heard the term placebo before? Do you know what it is and how it works? Here's an example that might help illustrate the effect. Have you ever had a tooth pulled? Is it painful? Well, as you probably know if you've had it done, it is very painful, and that is why generally we are given an anesthetic to numb the pain. Wisdom teeth are usually the most painful to pull. If your dentist told you he was going to pull your wisdom tooth without anesthetic, what would you do? Likely you'd find a new dentist. What if for some reason you went through with it? What do you think your experience would be? Likely not a very fun one, I imagine. What if I told you that in a study, people had their wisdom teeth pulled actually experienced very low levels of pain? In this study, they were led to believe that they were actually receiving pain medication, when in fact they received an inert, inactive injection of saline, which is salt water. However, their belief was powerful enough to influence their experience of pain. This is the placebo effect. This belief influences your outcome even if the treatment is not effective. Why does this happen? Well, we could draw once more from the biopsychosocial model for answers. The belief in the effectiveness of medications, therapies, or treatments affect our bodies in similar ways as do the actual medications or treatments. For example, MRIs demonstrate that these expectations activate the same regions of the brain as when people are actually given the treatment. Additionally, psychological reactions such as relieving anxiety can also impact health outcomes. Pain is a sensory experience, so being calm and believing the pain is less than it actually is, because you think you're receiving a painkiller, can decrease the experience of pain. Finally, the social factors also impact the power of placebo. For example, a pill given in a doctor's office by a man in a lab coat will have a greater placebo effect than one given in a classroom by people in street clothes. A major factor influencing both health and well-being is stress. What is stress? Stress is a pattern of behavioral and physiological responses to events when the events match or exceed our ability to respond in a healthy way. It isn't just the response, however. It also includes how we appraise the situation. Something that is seen as stressful to one person may not be stressful to another. In fact, some stress can be motivating, getting us to conquer challenges. Stress can occur due to happy events, and this is known as eustress, and also to negative events, and this is known as distress. However, both have similar effects on our body. Think about your own levels of stress. Would you say you have no stress? Maybe minor stress? Moderate stress? Or are you under high stress? What are the things causing you stress? You likely have daily stresses like dealing with traffic or lines at the supermarket. Maybe your parents and friends are making demands on you that are causing stress. We can also have really big stresses. Researchers have evaluated what events have the largest impact on us. Ranked at the top is death of a loved one, followed by divorce, which interestingly is followed very closely by marriage and birth of a child. These big stressors can have a major impact on our health and well-being. Even absent these large events, over time, little stressors can also have effects on us. What does stress feel like? What happens in your body in response to stress? The biological response to stress starts as a reaction known as the hypothalamic pituitary adrenal axis. This process starts with the perception of the stressful event. For example, losing your job or breaking up with your boyfriend or girlfriend. The hypothalamus sends chemical messages to the pituitary gland, which in turn secretes ACTH, which activates the adrenal glands. The adrenal glands release norepinephrine and epinephrine, also known as adrenaline, into the bloodstream. We have all experienced the effects of adrenaline, either through a scary movie, exciting roller coaster, or through exercise. It increases our heart rate, blood pressure, and breathing in preparation to deal with the stressor. The adrenal glands also release cortisol, a stress hormone, which increases the amount of glucose in our blood. These hormones have a lasting effect, usually beyond the period of time needed to deal with the initial stressor. We also discuss later how the stress hormones can have negative effects on our health. So what behaviors are these hormones preparing us for? Interestingly, the behaviors the hormones are preparing us for could depend on our sex. Physiologist Walter Cannon described the reaction from stress hormones as the fight or flight response. That is, we're preparing to either run away from the source of stress or combat it. This is an adaptive response that is shared by many other animals. The presence of the adrenal hormones norepinephrine and epinephrine gets us ready to stand our ground and fight or run away. Cortisol increases the glucose in our blood to give us energy to do so. In addition to energy and increases in blood pressure, pulse, and respirations, the fight or flight response also moves blood from the skin and organs to the brain and muscles, dilates our pupils, and decreases stomach activity. Because who wants to be eating when fighting or fleeing? The process has been studied and has a lot of support. However, as I mentioned, it could be different by our sex, since the majority of the early research on humans and animals was done mostly using males. So do females operate in the same way? Well, from an evolutionary perspective, we would argue that no, that the danger of combat is usually too costly to mothers, and fleeing could potentially leave children unprotected. Recent research by Shelley Taylor and her colleagues have examined the stress response in females and seen some interesting differences. Women under stress respond by protecting and nurturing their children and increasing social relationships. This process they have termed the tend and befriend response. Interestingly, our old friend, the cuddle hormone, oxytocin, seems to have some relationship to this response. Even though both males and females have this hormone, women release more of the hormone under stress, while men do not. Thus, there is some evidence that this difference in response and stress by men and women is not merely due to social learning, but has a biological basis to it. In the 1930s, Hans Seeley, an endocrinologist, began studying the physiological response to stress. He developed the theory called the general adaptation syndrome, which describes the pattern of these responses, which comes in 3 stages: the alarm stage, resistance stage, and exhaustion stage. The alarm stage is our reaction to the stressor that prepares us to fight or flight, or tend and befriend. This stage is where cortisol, epinephrine, and norepinephrine are released into our bodies, resulting in the elevated heart rate, breathing, and blood pressure. During this stage, our immune system kicks into high gear, since during a fight it's possible to be exposed to infection through injury. During the resistance stage, our body's defenses prepare for a longer battle against the stressor or stressors. Our immune response increases, and additional cortisol is released into the blood. Finally, once our defenses begin to fail, we enter the exhaustion phase. If this stage goes on for too long, there may be long-term damage as our immune system and other body functions fail. Seeley's theory demonstrates the impact of stress upon our immune system. Normally, our immune system is in place to combat things like bacteria, viruses, or allergens. However, stress, especially chronic stress, interferes with our body's ability to combat these invaders. Positive events can have a positive impact on our immune function by increasing antibody production. This graph shows the impact of stress on our health. In a study, healthy participants completed a survey and indicated their level of stress, and then had a cold virus swabbed into their noses. As you can see, the higher reported stress, the more likely the participants were to develop a cold. The stress interfered with their ability to fight off the cold virus. As mentioned earlier, short-term stress increases our immune function during the alarm phase. However, long-term stress depletes our immune system. Additionally, long-term stress can cause damage to our organs. Cortisol, which is released during stress, can damage the neurons in our brains, especially in the hippocampus, which is important for long-term memory. Stress also interferes with our ability to retrieve from our long-term memory. Since stress interferes with immune function, it puts us at risk for many other health issues, such as sexually transmitted disease, diabetes, and cancer. Recall people often respond to stress by engaging in unhealthy behaviors, such as smoking, unsafe sex, eating unhealthy foods, which further increases the chance of developing additional diseases. Heart disease is the leading cause of death in the United States for adults. Stress and negative emotions such as anger increases the risk of coronary heart disease. In the 1950s, cardiologists Meyer Friedman and Ray Rosenman noticed that they had to replace the fabric on their waiting room chairs quite often, with the fabric on the front of the seat and the front of the armrests wearing away the most rapidly. They noticed that many of their patients who were there for heart conditions had trouble sitting still for long times and tended to sit on the edge of their seats and get up frequently. They developed a hypothesis that the personality traits that led to these behaviors might also be related to their heart conditions. They developed the theory of type A personality based on these patients. Type A personality people tend to be ambitious, organized, impatient, proactive, and high achievers. They also tend to have higher stress and higher rates of heart disease, higher blood pressure, higher cholesterol, and engage in more smoking than individuals who are type B. Type B individuals are less competitive. They're easygoing and accommodating. While people with type A are more likely to have heart disease, it seems that not all of the traits that predict this. Rather, it tends to be primarily hostility. Angry, cynical, hot-headed individuals are more likely to get heart disease. This occurs in two ways. First, the negative emotions may lead to unhealthy behaviors to cope with this stress. Additionally, think about how your body reacts to anger. It's very similar to the alarm stage of stress, which has increases in blood pressure, heart rate, breathing, as well as dilated pupils. Thus, the anger acts on the body in a similar way that stress does. That is, it increases the allostatic load or wear and tear on our bodies. I've talked quite a bit about the danger of stress. It may make you want to join a monastery to avoid the negative impacts of a stressful life, since in our daily lives we are exposed to many stressors. However, recent research is finding that not all stress is made equally. In fact, some stress, or more specifically how we interpret and perceive that stress, can have a large impact on our health. There's a great TED Talk video this week by Kelly McGonigal on how we can make stress our friend rather than our enemy. Please watch it. I think it's very important for everyone. So how do we deal with our stress? I've already mentioned some bad coping techniques, like drinking, drugs, or eating unhealthy foods. So what are the positive ways to cope? How we deal with stress can be influenced by how we perceive or think about the stress. Lazarus proposed a two-part appraisal process. First, we determine if an event is stressful or not. If we perceive it as stressful, we begin to plan our coping strategies. We also begin coping in preparation for a stressful event. This is known as anticipatory coping. There are two general categories of coping strategies: emotion-focused and problem-focused. Emotion-focused strategies involve trying to manage the emotional impact of a stressor. Problem-focused strategies involve trying to take steps to solve a problem. Which is a better strategy? Well, it depends. If the stressor is something that can actually be solved, a problem-focused strategy will be better. However, if it is not solvable, then an emotion-focused strategy may be better. As an example, to illustrate these strategies, let's think about a coworker who causes you stress. Maybe this person is antagonistic and hostile. Emotional strategy would be to avoid this person. This may work, but what if you're forced together on a project and need to work with this person? A problem-focused strategy might be to take steps to decrease the antagonism, either by trying to make friends with this person, or you can take the issue to your supervisor to try and deal with it that way. People also have individual variation in their ability to cope with stress. You might know people who never seem stressed or roll with the punches of life. You may actually be one of these individuals. These stress-resistant or hardy individuals are able to deal with life's many stresses by adapting and appraising the stress as positive rather than a negative thing. These individuals are emotionally flexible and recover from stresses more quickly than other people. Some people are naturally more resilient, but the good news is that we can learn to be more resilient. In fact, the TED Talk I mentioned earlier discusses how you too can be resilient and make stress work for you rather than against you. In addition to individual differences in behaviors and appraisals of stress, social factors can also shield us from the negative impacts of stress. Social support is a strong predictor of recovery and management from stress. For example, patients dealing with illness, which is a huge stressor, recover quicker when they have positive social support. Thus, health psychologists have developed family interventions to help individuals dealing with acute or chronic illness. In this lecture, we have briefly discussed the field of health psychology, the biopsychosocial model of health, and the impact of stress. In our next lecture, we will discuss specific behaviors that can have impacts both negative and positive on our health.